Are you a victim of failed neck or back surgery? Does this mean you have to live with the pain the rest of your life? Well, we're going to ask one man who might have the answer. That's Dr. Miller with Total Health Chiropractic. Good morning. Thanks so much for being here.
Hi, Leanne.
Hi. So many Americans are facing this surgery, or they've had the surgery.
Yeah.
They're scared because what they had, or they're scared of what they're facing.
Well, you know, for average people like us, we would think, well, why would anybody ever go through a spinal surgery? But when you're dealing with chronic neck or back pain that just never goes away, and you know, many people have tried the shots or the drugs or the therapy, and they're not getting better, you know, you start to think, you know, what do you have to lose? And they go ahead with that. But there are a lot of risks involved with surgery, and really shouldn't be taken lightly, and it can create a lot of other issues that those patients have to deal with for the rest of their lives as well.
Well, let's talk about some of those issues that can arise.
Sure.
I mean, obviously you could end up with a chronic pain.
Yeah, and a lot of times what causes this, Leanne, is issues that is related to degeneration of the spine. So a lot of times people going in for surgery have degenerative disc disease, where these thick discs have actually dried out and thinned down, usually moreover like this model here where they're much thinner, and that can start pinching these nerves quite a bit. Other times those discs can start to bulge or herniate out, which this shows where it's pushing right into that nerve root. These conditions cause things like spinal stenosis, like you said, chronic neck or back pain, sciatica, which could be pain down the leg, or they might have issues down the arms or the hands. And you know, not to take away from the skills of these surgeons, it's just that that approach with surgery is a flawed approach, because many times they're just cutting things away, bolting the spine together to try to alleviate the pain, but they're not actually fixing the cause of that pain, and the condition progresses, and you know, then they're back for more surgery down the road.
I say that's the other thing. They could have another surgery down the road. Healing from a back surgery is not an easy task.
It takes a lot of work and a lot of time. It's, you know, you're limited in what you're able to do, but the problem is every level of our spines takes on its own amount of stress. And when you start fusing these areas together, the stress is pushed right around that fusion. And then those areas that had once been okay, they start to wear down very rapidly, and then they become the problem. And that's why a lot of people don't just stop with one back surgery. It just keeps spreading as the stress keeps getting pushed out. But, you know, as you see on this x-rays here, it's very invasive. There's some pretty big rods and screws. You'll never move again in those areas because it's fused.
Oh, wow.
And like you saw on the screen earlier, the risks are many. We've had families that have spoken where family members have died on the operating table and didn't make it through the surgery. Other people have come out of their surgery where they nicked a nerve, and now they have to be basically in a diaper and in a wheelchair, and you can't live the life. You know, you're going into these surgeries think you're going to feel better, and a lot of these patients come out and that's not the result.
Wow. All right, let's talk about decompression. Explain to people what that is and what is it that you have.
Well, it's a great alternative to neck or back surgery, Leanne, and some great things about this approach is that we actually help to correct the problem. It's a medical device that regenerates injured and degenerated discs. It's non-invasive, so they don't have to worry about all those side effects that were listed earlier. Patients are able to continue living their lives as they go through this. They're able to drive, work, do their chores. But as you see on this animation, it's just a very specific and computer-controlled stretching of one individual level of the spine to draw moisture and nutrients in, and if they have a herniation, it's retracting that and off of the nerves, so that these patients really are able to get back a normal life and live pain-free because we fixed the problem. And you know, they love it.
Yeah, we've had several people here in the studio with us, but we have a couple more that have actually sent in some testimonies as well. This is Roger, I'm understanding. Yeah,
so Roger already had gotten several back surgeries and fusions, and you know, as we just mentioned, the pain kept returning, and he is retired now and wants to live his life being active down in Florida, and they suggested more surgeries. He didn't want to go that route. He was a great candidate for a decompression program, and you know, I'm happy to say he's pain-free now, and he's moving to Florida within a couple weeks, and hopes to live a pain-free life and enjoy it down there.
Wonderful. And then we have Suzanne.
Yeah, Sue didn't actually get the surgery, but she had been doing the medications and the shots and was struggling to walk around the way she wanted to. And they were starting to discuss possibilities of back surgery, and she just really did not want to go that route. And she had heard about us, and we met, and she was actually a great candidate for a decompression program. And not only is she able to walk again, but I think it says on there her golf game improved like a stroke a hole. So
Nice.
Priorities.
Exactly. And the smile on her face says it all. You can tell she's feeling much better. But you do have a new patient special for our Fox 17 Morning Mix viewers who need to get in and talk to you about this before they go into the
Yeah,
life.
I mean, if you're frustrated or you just don't want to do the neck or back surgery that's recommended, I really urge your viewers to call our office, set up a consultation with me, and for $49, we'll meet and talk about what's going on. And usually we're going to move ahead with a thorough examination to, get to the root of their problem and see if they qualify for a decompression program as well, where we can help change their life and get them out of pain.
That's right. The phone number is right there, 616-828-0861. Make sure you call right now. If it's busy, just keep on calling. They are there to help you, or you can go online too to thchiro.com. That's thchiro.com to learn a little bit more as well. Thanks so much for stopping by.
My pleasure. Thank you.
Absolutely.